Ultrasound imaging has become an essential tool in the evaluation of patients with endocrine disorders. By mastering the techniques of neck ultrasound, a clinician can dramatically improve their surgical decision-making in patient care. The following video will demonstrate basic head and neck anatomy, ultrasound techniques, and the application of neck ultrasound for endocrine diseases. The following are the goals of head and neck ultrasound: to accurately diagnose disease, to identify persistent or recurrent disease, to facilitate monitoring of therapy, to improve the targeting accuracy of fine needle aspiration biopsies, and to decrease unnecessary surgical procedures. The indications for head and neck ultrasound include the following: to identify expected or unexpected pathology, to differentiate cystic versus solid or benign versus malignant lesions, as a means to localize abnormal parathyroid glands, to monitor therapy and detect any evidence of residual or metastatic disease. It is accurate and valuable to consider head and neck ultrasonography as a natural extension of the physical examination, similar to a stethoscope. Neck ultrasonography is versatile and has widespread clinical utility. Studies from our group and others have demonstrated that preoperative ultrasonography has a clear advantage in diagnosing and treating endocrine disorders, resulting in an alteration of patient management a third of the time. Ultrasound is non-invasive and simple to perform, both in a clinic setting and in the operating room. The patient is placed in the supine position, with a pillow placed beneath the shoulders to help gently extend the neck. The examiner is positioned to the right of the patient with the table at a comfortable height. Gel to enhance the acoustic signal is applied to the area to be examined. We have found that optimal imaging is obtained by using a small to medium-sized high-frequency transducer. Regardless of choice of ultrasound machine and training, the following remains constant. One must ensure proper patient identification along with probe orientation and transducer settings before beginning the examination. Images of structures in the neck are obtained both in the transverse and longitudinal views. Each orientation provides for a unique view and thorough assessment of neighboring structures. As demonstrated, a painting motion up and down is best for the transverse views, while a sweeping motion that rocks the probe left and right facilitates longitudinal views. The following series of slides demonstrates the basic anatomy as seen on a transverse ultrasound image. First, we see the skin and subcutaneous tissues, then the strap muscles. The trachea is illustrated by the circle. The thyroid gland is midline and symmetrical, with the isthmus anterior to the trachea and the right and left lobes on either side. The carotid arteries are noted lateral to the right and left lobes of the thyroid gland. The esophagus and deeper structures of the neck can also be identified. As imaged in the transverse view, the anterior and posterior dimension of the thyroid lobe measures 1.5 centimeters by 2.5 centimeters, while the longitudinal length measures approximately 5 centimeters. This video clip demonstrates normal thyroid anatomy in real time. The I represents the isthmus, the T, the trachea, as the probe scans laterally, we identify the right lobe of the thyroid gland, and lateral to this lie the carotid artery and jugular vein. The following is a transverse view. Here we can appreciate a longitudinal view.